Hello, good crowd. We're going to have such an important conversation today about brain cancer and a radical new treatment program. We have with us Catherine Ivy. She's the founder and board president of the Ben and Catherine Ivy Foundation, which operates the Ivy Brain Tumor Center at the Barrow Neurological Institute. They're doing amazing things. You want to know about this, so stick around. You don't want to miss this.
Welcome to the Your Mark on the World show with your champion of social good, Devin D. Thorpe.
Our sponsor, Johnson & Johnson, matches most individual donations up to $250 at caringcrowd.org. Catherine, welcome to the show.
Thank you. Good to be here.
Well, we're thrilled to have you and so grateful that you would make the time for this conversation. It's such an important one, I think. I want to come at this from the reality that you did, right? You came to this you and your husband, Ben, long had wanted to create a meaningful philanthropic work that redefined itself when your husband got sick, I think. Tell us a little bit. I know this is hard, and please forgive me for asking, but I think it's an important context for everyone to understand. Tell us about Ben's experience.
Well, thank you. Well, it was 2005. My husband and I were living a very happy life. We both worked in business. He could have been a poster boy for Whole Foods. He was very dedicated to his health, never sick, very active, no really bad habits. And we were hiking and his thumb went numb. And we thought it was probably a pinched nerve. And then his tongue felt weird. So we went to the doctor thinking it was no big deal. It ended up being a brain tumor. So we had surgery 3 days after that. And it ended up being glioblastoma, which is the most aggressive, fastest growing cancer there is. In 50 years, we can't get people even living long enough to really study the disease. So upon that, after that day of surgery, he passed away 4 months later. And it was so fast and so drastic. And it became very clear what the purpose should be for our foundation, because we learned that there's been no advancement in this disease. And I say pretty much the same results today.
That's so hard. Well, Catherine, a lot of good has come out of that. Tell us about the radical work you're doing with your phase 0 trials at the Ivy Brain Tumor Center.
Well, I'm in my 14th year of doing this foundation full time. All we do is focus on trying to contribute to a cure for brain cancer. And not that money can cure a disease, but come this month, we will have invested $100 million in research, and there's really been no change in 14 years. It's been a little tough, to say the least. And so our board decided a few years ago that we needed to hyper-focus, and we're going to place a big bet. And we went around the world for a couple of years trying to determine that project. And fortunately, it was in my backyard in Phoenix, Arizona, because the Barrow does a very high volume of brain tumor resection. That brain tumor tissue is the golden egg. But finally, it's a real joy. The last 2 years through this phase 0 clinical trial program, I feel hope. I've seen results, and it has shaken up the process on how to look at brain tumors. And so it's a lot of fun, and we're diving deep and going forward.
Now, I want to make sure I understand how the phase 0 trials work, but I think what you're doing is you are giving one individual a small dose of a combination of drugs that doctors think might work for their particular physiology and their tumor. And then the next day, having them receive surgery to remove as much of the tumor as possible. And then over the next few days, maybe a week, you are evaluating how that tumor tissue is reacting to the drugs to determine if they're effective. Am I understanding that correctly?
That's exactly true. The drugs are matched to the genetics of the patient's tumor. But what I love about the phase 0 is nothing is lost. You only gain. There's no side effects because it's a microdose of the drug combination. And you know if that combination is going to work in days. Right now, when you go on a clinical trial, you wait 3, 4, 5 months to see if it's working. When the average survival time is 16 months, 4 and 5 months is a very long time. Yeah. And you just don't have that luxury of time. And so this process speeds that up and gives the patient more opportunity.
Is it fair to say that in a typical glioblastoma surgery, they're not able to remove all the cancer so that it's likely to continue growing or to grow back?
Absolutely. This is not too scientific, but it's like a liquid tumor. And so all the little crevices of the brain, it is virtually impossible to remove it all. They certainly try, but we need our brains. They can't remove the whole brain.
Yeah. So then this process could theoretically be repeated several times in a matter of months, allowing someone then to find a treatment regimen that actually does work to reduce or control or even eliminate the tumor. Is that right?
That is correct. One of the reasons this is working so well, especially at Barrow, is the volume of patients. To compare, for instance, with breast cancer looks pretty similar among groups of patients. But when you get to brain cancer, every person's very unique. So I don't think this is going to be a situation where two or three drugs work for everyone. I think there's going to be subcategories of groups. And I feel through this phase 0 clinical trial, the patterns will reveal themselves into those subcategories so that that will improve the chances for people. Another thing with the phase 0 is right now we open and close a trial within 6 to 9 months, an entire trial. Most traditional clinical trials take 5 to 7 years. And so when your diagnosis is you have 16 months to live, you can imagine the discouragement when a clinical trial is 5 to 7 years.
I hate to ask this question, but can you help us put your success to date into context? Have you had anyone cured? Have you had anyone be cancer-free after treatment? What kind of results are you getting here?
Well, that's a little tricky because that's absolutes. And I think with any cancer, that's a little difficult to describe, but we have people living longer. You want to say someone's cancer-free, but then it can come back. So we're always a little nervous to say that. But what we have seen is definitely people are living longer because we started this on a real small scale in 2013, and we were so encouraged by the results. That's when we did this big grant to scale it so we could help more people. And so right now we're really trying to just get word out to everyone to try this type of program so that they can help themselves.
Now, you've had your focus on this now for nearly a decade and a half, but you're not an MD or a PhD, but does the application of this approach theoretically work for other cancers as well? Neuroblastomas, pancreatic cancer, or is there something unique about the glioblastoma that makes it particularly relevant here, or only relevant here?
I am not a doctor. I know it can be used in other types of cancer. If I remember correctly, I think it works really only with solid tumors.
Okay. Well, it's a fascinating new process. As you look back, what are you most proud of having accomplished so far, Catherine?
Well, I tend to have ambitious goals, and so until we have a cure, I probably won't be happy with anything. But, when you meet the people that are living longer and you see just that happening, that's been immensely rewarding. But we have a long way to go. It's been 50 years and one drug and no change for these patients. And so I think shaking up the process and doing drug cocktails is what is going to move us forward. And so the last 2 years, I just feel like that train is moving faster, and that's been very rewarding. But I honestly will not be at peace until there's an absolute cure. So,
well, Catherine, your work as a philanthropist is so vital, and there's people working on so many good causes as philanthropists. What's the most important lesson you've learned that you would pass along to a new philanthropist? I think of these Silicon Valley millionaires and billionaires that are now faced with the challenge of using their money for good. What would you tell them?
Well, there's lots of different ways to run foundations. I come from the business world, so I mostly apply those principles. I run it very lean. The money is for research. I do multi-year. I'm very accountable, especially towards the budgets. But I think, I am not a physician. I'm a little fluent because I've just been exposed to it for so long. But it gets a little tricky because people are very passionate about their research. And they really believe they have a cure, and they will say anything to get the funding to make that happen. It's not that they're trying to deceive you. They have to bet on a horse and bet their career on a theory. And so being really objective and taking the passion out of it, just because someone is passionate does not mean they're going to find a cure. And I think creativity, looking outside the box, there's a lot to learn. So,
great insights. Now, Catherine, there are a lot of people who have been through the tragedy you survived with Ben's loss. You were a young widow and faced with all of the trauma, and I imagine almost everyone that goes through that thinks to themselves at some point, I need to do something about that. But the honest truth is most of us don't, in fact, react to tragedy that way. We ultimately move on. What empowered you, emboldened you, motivated you to actually pick up that ball and run with it as you have?
Well, I was fortunate. Before Ben passed, we had many long talks, especially the last 6 weeks, of what he envisioned and what his dreams were. And, for my personality, helping other people really brings a lot of joy to my life, trying to help others. And so I honestly feel privileged to do this. At the same time, I do have to create boundaries, because when anyone has a neurological disease, their personalities change, and especially with glioblastoma, there's so much suffering. It's very difficult I'm just, some days I feel like everyone around me is dying. And not everyone with cancer dies. I have to remember that. But it was executing Ben's desires, it's a very fulfilling thing for me. So I honestly feel privileged.
Yeah, that's great. Catherine, what is your superpower?
My superpower? Now, how do you define superpower?
What makes you successful at what you're doing?
I think being very focused on the mission and not deviating from that. I think if persistency, eventually, your numbers got to come up. And so just staying very focused and working really hard and being as smart as possible. I just think statistically, something's got to hit eventually.
Yeah, fantastic. Well, Catherine, thank you so much for taking the time to be with us today. Before you go, do you take just a minute and tell people how they can learn more about the Ben and Catherine Ivy Foundation and the Ivy Brain Tumor Center at the Barrow Neurological Institute, and how they can connect with you?
Well, my foundation has a website, ivyfoundation.org, but for patients, within 24 hours, they can have a free screening if they're eligible for a phase 0. And that website is ivybraintumorcenter.org. It's very confidential. And when a patient comes to Barrow for a phase 0, that patient is not transferring to Barrow necessarily. They work with the existing physician. So they collaborate. It's not a transfer of patients. So, there's opportunity for everyone, and I hope the word gets out there so more people can live longer and we figure this out.
Fantastic. Well, Catherine, thank you so much for taking the time to be with us today. It's so wonderful to be able to have the opportunity to talk about cancer and hope in the same sentence. So thank you very much. And we wish you every success in your efforts to cure cancer.
Thank you. I'm working on it. Okay.
All righty.
Thank you.
All righty. Let's do some good.
At Caring Crowd, we believe everyone has the power to make a difference. Through our crowdfunding platform for community health, we empower passionate people to drive real change. Whether you work for a nonprofit organization, volunteer, or want to get involved for the first time, you can post a campaign on Caring Crowd. Join us, because caring is where change begins.
Thanks for tuning in to the Your Mark on the World show, the Social Impact Podcast. Please subscribe via YouTube, iTunes, Google Play, Stitcher, or Spotify.